Hello, I'm Dr. Arshnoor from Dr. Arshnoor's OET Institute. In the series of the role plays, today's topic is for nurses and the setting is medical clinic. This is a very, very important topic and many times this has been asked and very commonly asked in the exam. This is about educating the patient regarding the self-monitoring and administration of insulin injections. Years old and is diabetic, and you have to tell about the patient to start with the insulin injection, and obviously the patient will be quite anxious to start with the injections, and you have to convince the patient regarding this. So this is convincing and educating the patient simultaneously. In this case, first of all, you have to introduce yourself that good morning or hello, I am so-and-so and you're attending nurse today, or I'm one of the registered nurses working in this medical clinic. Then second question, how may I help you? The patient will tell that actually my doctor has asked me to see you today regarding this self-administration of the insulin injection, but I am worried because I can't say that I will be able to start with this. Then you have to ask the patient regarding his or her concerns. Let it be the patient's name is Jack, and you have to start the conversation by saying that, Jack, can you please tell me that what you are scared of? Why don't you want to start insulin injection? The patient might say that, first of all, it's quite painful. Then you have to convince the patient by saying that the needle is very fine and you will not find any problem while injecting this injection. Then the second question could be that I'm not a nurse, I'm not a doctor. How can I administer injection by myself? Then you have to tell the patient that that is the reason for your appointment today or for your visit today. Your doctor has asked you to learn this from me because self-administration of insulin injection is quite common in such of the cases, and patients are safely injecting injections by themselves. I'm going to teach you that regarding today. So after that, you have to explain the patient about the procedure, how insulin injection can be injected. Tell the patient that first of all, there are 4 common sites where the injection can be injected. This could be deltoid muscle, and it could be thigh, it could be the hip region. But the most appropriate site of the injection for the self-administration, that is around the belly button or around the umbilical cord. So this is 4 fingers away from the navel or 4 finger away from the belly button. You have to tell the patient that he has to inject the injection on the different sides or every day, keeping in view that he has to inject the injection 4 fingers away from the belly button. Then the second could be the patient, if he wants to go to some nurse or doctor, then he may go with the thigh, hip, or deltoid muscle. These are other appropriate sites for the injection, but for the self-administration, the most approachable site is around the belly button. Then you have to tell about the dose. The patient may ask that how much dose can I get? Then you have to tell that nowadays, with the latest technology, there are some injections in the form of the pen. These are called pen injections. Already the dose is given there, and you just have to inject the injection. And after that, the patient will ask, suppose I'm not able to get it, then you have to tell the patient, then it is according to the recommendation of the doctor. Whatsoever the doctor prescribe you the dose, you have to take that much dose of the injection. After that, the instructions are to be given to the patient. So, Mr. Jack, first of all, it's very, very important for you to clean the site always whensoever you are going to inject the injection. Do not rub it much. Then discard the needle, discard the syringe, because it should not come in the approach of the children. and it should be safely discarded in the bin, which is allocated specially for setup of the injections. Then you have to tell the patient about other instructions. First, that he should always keep some candies or some sweet in his pocket. If he finds any problem, hypoglycemia, that he should be able to take that. Secondly, he should not become anxious because self-administration of insulin injection is quite common and he can easily maintain. Thirdly, if he's going for some party or is going outside his house, he should carry the required dose. He should not miss it at home. And fourthly, he should stay stress-free, should not put stress of injecting injections. And fifthly, we can say that he lead a healthy life, or he should think positive, should engage himself in the positive activities, and should not make himself much anxious. By telling all these things and other things, that the injection need not to be refrigerated, but it should be kept at the clean, it should be kept at the dry and some cold place. It should not be kept at the direct sunlight exposure. It should not have direct sunlight exposure or should not come in the contact with the sunlight. Secondly, if he finds any problem with the color change or there is some precipitates in the injection, that injection should not be taken. In this way, all these instructions can be given to the patient for the self-administration of the injection. And this topic can be asked in the exam also, because it is commonly asked in the exam. Hopefully, this information will be helpful for you. You can use these tips to play this role play in the exam. Otherwise, you can prepare yourself. You can self-practice with your friends or with your colleagues also. And this will be a valuable information for you. If you like this video, do not forget to like and share this video so that it should help other people also. And if you have not subscribed our channel yet, subscribe it right now so that you should be able to get the latest information on our channel whensoever we are uploading any new video. Keep in touch, stay healthy, happy learning. And if you feel that you want to get some other video, you can comment in my comment box. I'll read those and I'll answer those also. And if I find that any video is your wish, I'll definitely prepare that video also. Thanks for watching. Stay connected.